How old are you?
14.
Okay. This is a 14-year-old patient that presented to us with Tourette's.
Hey!
Okay. So what are the tics that you experience?
I have a lot of neck twitches, as you can see. I usually just have to crack my neck. I have to keep flipping the hair out of my face because it touches my eyes and that just bugs me. Hey! I yell a lot. I have a few verbal tics. I have to say things. I haven't been doing those lately though. I've been really doing the necks twitches a lot lately. So.
Do you want to say
Keep doing it. Keep explaining to the audience.
I have some kicking and hitting tics. I don't actually hit people, but I have to hit walls and stuff, mostly to give off pressure. I bump into stuff a lot. Sometimes I have to bang my knuckle off of something until it hurts. If it doesn't hurt, then I have to keep doing it. Lately I've been doing I have to flex my bones and my muscles and stuff. Sometimes I have to like squint and make faces. Usually when I look in the mirror, I have to. Just because I have to see myself do it. I have to do it in a certain way. Otherwise I have to keep doing it. It has to be perfect or I have to keep doing it. It also really has to do with OCD, my Tourette's. That's pretty much why I have to get it perfect. So. Hey! Usually when I'm nervous and stuff, or if I have more attention, I do more tics. So. It doesn't matter if it's good attention or bad attention, so. I do have a lot of fun with Tourette sometimes. With friends, we just joke about it and stuff. It's fun being in an environment where kids can accept you for who you are. I was lucky to be in an environment like that.
But all the world's not that easy, right? You get cussed out a lot and looked at.
Yeah. I love acting and stuff, but I went to this theater in Spring Grove, and this girl actually came out and cussed me out because she was upset that I was ticking during the play. But I just explained to her I had Tourette's, and I went on with it. I try not to let that sort of thing bother me, so that I can just live on with my life happily. It's not good to focus on that sort of thing. I did have depression from Tourette's around 2007 because I used to let it hit me hard, so just stopped focusing on that. So.
Okay.
We're going to do the best we can for this young boy. Fortunately, he's understands his problem because he has a IQ of 128. These patients are not low IQ children. They're very, very smart, trapped in this disease, and this is what the dental profession should be doing to help these children out all the time.
This is his occlusion right now, open wide. This is the appliance in his mouth, and it's highly indexed. Bite. Now see, and he goes right into the indexing, and this moves the mandible forward, taking the pressure off his temporomandibular joints and reducing the recurrent dislocations. So just look into the camera and let them see your face. Do you want to mention any benefits or non-benefits you've received over the past 6 days?
Well, actually, I got a lot of benefits. Right away, I actually I stopped doing tics a lot, and lately I haven't done them at all. But I did take my brace off one time, and I actually had a tic explosion where I was going nuts. I think that happened because I took the brace off. So that was the downfall part. But I think this brace really works.
This is Jesse as he returns 6 weeks later. And what we've done is convert his intraoral orthotic from a pivot appliance to a repositioning appliance, where we have lowered the height of his appliance and indexed it, so he is now biting with his mandible in a forward position here. This further decompresses the tissues of his temporomandibular joint. Okay, pan him. You can see him here. Look in the camera here, and say something to the viewing audience here. How you've been doing in the last 6 weeks? You've been in a school play.
I've been in a school play and a band concert.
Okay, don't look at me. Look at that.
Oh, sorry.
Okay.
I've actually gotten to the point where it's working so well, I kind of forget it's in my mouth and it's just there. It's already it's part of a normal day routine with it now. And a lot of my tics, I've noticed, have kind of drifted away to the point where they mostly never come up. I haven't gotten mad at all since I've gotten this piece in, to the point where I've yelled at someone. I haven't yelled at anybody in a long time now. I haven't been emotionally overbearing at all in any state. And I have a clear mind every time I have it in, that I can think about my work and get it done. And my grade's been going up. So.
I'd like to introduce you to Jesse's father here, who has accompanied him, and to say a few words. Come on in here.
Yeah, Jesse's teachers have reported back to us that his tics are significantly less during class time. His focus is better, and we've definitely felt around the house that Jesse's ticking less and that he's more peaceful. There's some kind of emotional connection here too, where just not ticking so much has helped him to relax in a lot of areas. But he was yelling certain words 2 to 3 times a minute, and now we can go an hour and not hear it at all. So.
This is a view of the patient's habitual bite in centric occlusion. Notice the mandibular dental midline is off to the patient's left. When you see this occurring, check the maxillary and mandibular frenum, which are the skeletal midlines of the maxilla and mandible, to see that they are aligned, one over top the other. Also notice the deepness of his bite. His upper incisors overlap about 70 to 75% the length of the lower incisors. To you, this may be good incisal guidance, but to me, it is very, very harmful. This is a view of this patient's occlusion on the right side. It is a class 1 dental relationship. This is a view of the patient's left side in habitual occlusion. Notice the premature loss of a lower left second bicuspid. The clinical information pertinent to this patient is as follows. MRI imaging shows that the right TMJ disc is medially displaced. This was on the coronal images. He was diagnosed with Tourette's at 7 years of age. Prior to 7, he was diagnosed with attention deficit hyperactive disorder and obsessive compulsive disorder. These are medical diagnoses by his pediatrician and family physician. He has left temporal headaches 2 to 3 times per month, which are so severe that it forces him to go to bed for relief. Examination showed bilateral TMJ clicking upon opening the mouth. He bruxed his teeth. He has a constant barking sound which decreases when I repositioned his mandible edge to edge at a height of 2 tongue blades. He also suffers from bilateral tinnitus, which is a humming sound. He has left and right face pain, worse on the right than the left. It's painful for him to chew food. He has left and right neck pains, left and right stiff necks, cervical crepitus upon movement of his head left and right shoulder pain. When I palpated around his head and his neck, he elicited a painful reaction in 38 different anatomical areas. Okay, this is Justin, who has come into our office. And as you can see that he's a Tourette's patient, and we're going to begin his treatment today with fitting him with a lower mouthpiece to stop all these uncontrollable motions that he has. And we're going to videotape these motions for a minute or two, just so the viewing audience can appreciate what he has to go through. Justin is a 17-year-old young man who began suffering from these things at the age of 8 years of age, and it's about time that he got rid of them, and this is what we're going to do for him today. Okay, I've just finished working on the appliance, and we're going to put it in for the very first time right now on this young gentleman. Did that hurt you?
No, it's checking.
Okay, how's that feel now?
Weird.
Does it feel even? Or does one side feel a little higher than the other?
Feels pretty even.
I am inserting the lower mouthpiece at what I think is the correct vertical height. This is the most critical element in the delivery process. As you will see, this is not the correct vertical for this patient because we subsequently modified it by adding to this height the thickness of 1, then 2, and then 3 wooden tongue blades. And with each addition, the patient reported that his symptoms and urges improved. We then added additional acrylic to take into account this additional height of these 3 tongue blades to the original height of the appliance. And you will see the response of the patient to this height. Chop, chop.
Really?
Tell me what's happening to you.
Well, what?
Does the urges seem less?
I guess. It's not really, I don't really shut my mouth. It's
Yeah, I don't want you to shut your mouth.
like close my jaw.
Open.
Now, are we just seeing if my chicks come?
That's what?
If my chicks are coming down? Is that what we're doing here?
Yeah, just see if it's calming them down more.
It is.
With this in there?
Yeah. It's just a little bit.
Does that help you? The tongue blade help you? Seem to be helping you?
We put That's a lot better. Right there. Two of them. Or two more.
Okay. Try 3. Tell me if 3 is better than 2.
Oh! Two and 3. I mean, they're both
Okay.
same.
Take it in. Mix me up some stuff. I've added some additional acrylic here,
Thank you.
the amount being the thickness of those 3 additional tongue blades. Now I'm going to let the acrylic harden and trim it to the thickness of those 3 tongue blades. Can you tell that's higher?
Yeah.
How does that feel?
A lot better. It's a big difference.
Quiet you right down, doesn't it?
Yeah. Just a little bit. My tics are just way much more calmed down.
Yeah. Let's give him a new appliance. He had broken the clasps off his original appliance, which decreased his stability. His symptoms did not return. He has been wearing an appliance for a total of 5 months. And we are showing you this video footage to show that his corrections and improvements are long-lasting. He will tell you that his symptoms started to diminish within a week of the original appliance's insertion, and they have been gone for the last 5 months and stayed gone. In his history, he also had 5 years of constant everyday occipital headaches, which are headaches in the back of his head, every single day for 5 years prior to coming to see me, and he hasn't had any of those at all since the insertion of this appliance. He's going to say something to the viewing audience now. Just tell them what how you're coming along.
I am doing fantastic since I've got this appliance in. It has, my tics have completely diminished. Even after I have my appliance out, my tics are still not there for hours and hours after I have my appliance in. I haven't really tried to go days, but I've had them out for a couple hours.
He's had a total of, he estimates, of 20 tics.
Yes.
He got this appliance over the summer, and the children in his previous grade school knew about his tics, so he went and registered in a brand new high school, and they are totally unaware that he is a Tourette's patient. He's got them all fooled.
Yep.
And he started to make relationships with girls now. Got them fooled too?
Trying to.
Good for you. Anyway, he's going to continue wearing this, and It's very, in my opinion, it's very easy to treat these Tourette's patients, at least teenage boys and girls. They're much more easy to treat or respond a lot quicker than Tourette's patients in their 40s and 50s. Those are the ones that seems to be more resistant to treatment and takes longer to treatment and takes greater skills to treat. It's much easier to treat these youngsters.
Justin is doing so much better. He hardly notices, his tics, and he started at a new school, and they haven't even noticed that he has Tourette's. And when we first went in to talk to him, we told him how bad it was, and they can't believe it, because he doesn't tic at all, hardly. I mean, it's an amazing difference.
Have you brought home a young girlfriend yet?
Not yet, but we're working on it.
Oh, okay. Well, that'll probably be the next step. Okay. This patient returns after 2 months since his last appointment. We haven't adjusted his appliance yet. He tells us it's worn down a little bit and his tics are starting to creep back in a little bit, and so we're going to adjust his appliance, check it completely out, restore it completely, and then send him on his way. Another telltale sign is how deep his bite is. Most of these patients with the appliance in will have an open bite when their symptoms are gone. And this patient has worn down the appliance, so his teeth are overlapping them a lot. An overlap like this might be good in a normal patient, but is not good in a Tourette's patient. We want an increased vertical dimension. We have just finished adjusting and rebuilding this patient's appliance. Bite. We have increased its height. Remember when he bit down, his teeth overlapped about 30 or 40%. Now when he bites down, he is open about 3 or 4 millimeters. This represents about a 6 or 7 millimeter increase in height on his appliance. Do not be afraid of going into an open bite scenario when you build these patients' appliances. They need all the occlusal support you can give them to support these joints here, or decompress these joints and take the pressure off the auricular temporal nerves and its branches. We built his appliance up vertically, increasing his vertical height today. Zoom in. Bite. So he goes from where about the level of where my thumb is to this amount of opening right here. This is a considerable increase. He feels it benefits him. It decreases his urges and his tics.
Yeah, significantly.
You want to tell the audience how you've been in the last 6 months?
Good, yeah. I mean, it has worn down probably the past 3 months or so a lot. And you can tell my tics they come back. But they aren't as bad as they used to be, even with it worn down. But it feels good.
Okay. Okay, and you feel we're helping you out?
Yeah.
Okay, good. Okay, it's been 3 months since you've been in here. How have you been doing?
Great.
Good.
Yeah,
No problems?
No?
Okay, we're going to build your appliance up today.
Okay.
And in fact, it's already built up and it's hardening up, and I'm going to polish it up and fit it to you. And we'll have it ready for you in about 5 minutes. Okay?
Okay.
This patient returns after 2 months since his last appointment. We haven't adjusted his appliance yet. He tells us it's worn down a little bit and his tics are starting to creep back in a little bit, and so we're going to adjust his appliance, check it completely out, restore it completely, and then send him on his way. And that's what this appointment will consist of. Bite. Come in from the front. Another telltale sign is how deep his bite is. Most of these patients with the appliance in will have an open bite when their symptoms are gone. And this patient has worn down the appliance, so his teeth are overlapping them a lot. An overlap like this might be good in a normal patient, but is not good in a Tourette's patient. We want an increased vertical dimension. We have just finished adjusting and rebuilding this patient's appliance. We have increased its height. Remember when he bit down, his teeth overlapped about 30 or 40%. Now when he bites down, he is open about 3 or 4 millimeters. This represents about a 6 or 7 millimeter increase in height on his appliance. Do not be afraid of going into an open bite scenario when you build these patients' appliances. They need all the occlusal support you can give them to support these joints here, or decompress these joints and take the pressure off the auricular temporal nerves and its branches. Turns for a treatment checkup. It's been several months since we've last seen him, and his appliance had worn down, and his tics had started to creep on back, and we have rebuilt the appliance at this appointment. And he's going to tell the viewing audience how he's been coming along in the past several months.
Okay. It's been progressing fairly well. It's still, when it wears down, my tics come back slowly, but it's far better than what it was before I even had the appliance. My tics are 80 to 90% gone. I still have some, but it's not as near as it was.
And you're off all medications, right?
Yeah, for this.
Okay, good. This patient is 21 years old. He has a maximum interincisal opening between his incisors of 80 to 81 millimeters, and left lateral excursions of 18 millimeters and right lateral excursion of 8 millimeters. The MRI report says the temporomandibular discs are within the condyles bilaterally. I don't know what this means, other than the radiologist who read the report is unfamiliar with TM joint radiology. There is no translocation between the closed and the open mouth positions. This really means there is no translation of the condyle between the closed and open mouth positions, which is highly unusual for a person who can open 80 to 81 millimeters. His tics consist of eye blinking and eye rolling, head jerks, facial grimaces, nose twitching, mouth opening, lip licking, grunting, snorting, and spitting. Whistling, arm extending, touching objects, smelling objects, jumping, skipping, and hopping, tensing muscle groups, making animal-like sounds, unusual voice changes, and self-injurious behavior. Previous treatment he's received is 2 years of orthodontic treatment, multiple neurologists, psychiatric care for the past 11 years. His medications are Tegretol, Clonidine, Haloperidol, Klonopin, Lovesa, Benzotropine, Vistaril, Zoloft, and medical marijuana. Additional treatment consists of a deep brain stimulator implanted 2 years ago, and then a second deep brain stimulator implanted 1 year ago, neither of which has worked. His self-injurious behaviors consist of biting his cheeks, gagging himself, slams the side of his body with his elbows. He tried to gouge out his left eye due to tics and severe pain in the left eye, and was put on a 17-day medically induced coma. This is this patient's frontal head x-ray. Notice the brain stimulator implanted on his left side and the one implanted on his right side. Notice the wires that run from these down his neck into his chest on either side. While looking at this x-ray, observe the overgrowth of his nasal turbinates, which have deviated his septum to his left side, and the misshapen piriform or nasal fossa. This is his patient's lateral skull x-ray. You can see the implanted deep brain stimulators and the wires that go up over the brain and down the head and down the side of the neck into his chest. This is this patient's submental vertex x-ray. You can see all the wiring implanted in his skull. Notice also that one side of his skull is a little bit convex, where the other side is flattened or concave. This is a severe cranial distortion and should be addressed. This is a young male that comes in with Tourette's syndrome. He's got eye-blinking tics, head jerk tics, facial grimaces, nose twitching, lip licking, snorting, grunting, spitting, whistling, jumping around, hopping, tensing of muscle groups, grunting, and a half a dozen other tics. He also has a self-injurious tic. You can notice his left eye patch, where he had a tic in the center of his left eyeball that he tried to calm down. This resulted in him being put in a hospital-induced coma for 17 days to heal the area. He's had 2 deep brain surgical stimulators placed in his brain, which have done no good for the tic in the center of his left eyeball. He also has left face pain and left cheek or cheekbone pain. His MRI is negative for TMJ dysfunction. And he comes in wearing a lower splint like this. We'll put this in. Yeah. But it doesn't give him any relief. He wears a dowel here on top of it to increase his vertical. And it is this vertical that gives him some relief and decreases his urges. So today we made him an appliance, which we're going to deliver right now, which our starting point, our starting height is going to be the combined height of these 2 appliances. Like this. So when he occludes down, this is going to be his opening here. He says this diminishes his urges approximately 50%. And that's after just a couple of minutes of the appliance sitting in there. Okay, how's that feel? Okay, do you want to say anything to the viewing audience? Like all that you've been through and things like that?
No.
This is your chance now. You're on television.
Okay, I don't want to be on television.
Oh, he's shy. He's shy. Okay. I'm just teasing.
You're not on television. So.
I know I'm not television.
Okay. We're going to dismiss him now overnight, and he's going to return tomorrow for his first checkup. And we'll show you what his appearance is and the decrease in his tics when we view him tomorrow. Returns after wearing the appliance approximately 24 hours. He felt it was a little bit too low, so I increased the height 2 millimeters on each side, which is the thickness of 1 tongue blade. You can tell from his countenance that he's already improved in a short period of time. Notice how the patient's head is more upright, that his facial grimaces and distortions have decreased, and most importantly of all, his shoulders have squared off, so his posture has changed. Do you have anything to say to the viewing audience?
No.
You happy with what I'm doing for you?
Yes.
Okay. Thank your father for making it available to you. You owe him big time. Big time. This Tourette's patient is 21 years old, and his tics began at 10 years of age. This is a late date for saying the tics began. Usually they begin prior to 10 years of age. Constant blinking was his first tic, He now has vocal tics and repeats things constantly. His body is always hot. Asthma my whole life. Was scheduled for deep brain surgery 2 days prior to my first exam at Johns Hopkins University. His parents canceled the deep brain surgery and decided to come see me instead. TMJ symptoms consist of bilateral TMJ clicking upon mandibular protrusion, right TMJ crepitus upon opening of the mouth, bilateral frontal headaches for years and years, bilateral temporal headaches for years and years, left face pain, constant clearing of the throat, a maximum interincisal opening of 50 to 53 millimeters, left lateral excursions of 7 millimeters, right lateral excursions of 8 millimeters. Since these lateral excursions are limited, you might suspect medial disc displacement. The MRI report says there's no evidence of anterior disc displacement in either joint, which you would surmise from the fact that he had an interincisal opening of 50 to 53 millimeters. However, the coronal images show bilateral medial disc displacement, which is the reason for the diminished lateral excursions of the mandible. This is a young man who's 21 years old, who's a Tourette's patient, who found out about us 2 days before he was scheduled for deep brain implantation at the Mayo Clinic. And his parents canceled that surgery and came to see us. And we are working him up, and we took an impression for a lower appliance, which we are going to deliver tomorrow, and then check up on the next day. Here. When did the symptoms, the tics and all start?
5th grade.
5th grade. How many years ago
It was 10 years ago.
10 years ago. And you have both eyelid tics and you have vocal tics?
Vocal tics and movement. It really gets worse in the afternoon and at evening. Right now, it's pretty mild.
Okay. And you had a tic explosion yesterday.
Yeah, yesterday when it was around 2 o'clock, and all day it was just kept repeating what I was saying, speaking loudly, having that my head moved jerking, and moving my jaw around, and that's about it.
This young man has traveled all the way from Charlotte, North Carolina to see us, and we're going to do our very best possible work to eliminate these tics.
Yeah, if we're doing something exciting or something that I wouldn't do every day, like came here, it was exciting learning about this, and yesterday we went to the Washington monuments and all that. My tics get unbearable, and I'll sweat, I'll get headaches, and we had to call the day early yesterday because it was so bad.
Oh, you had to go home early from your touring?
Well, yeah, we had the choice to stay, but I chose to go.
Okay.
Yeah.
Great. Well, it's interfering with your personal life. And
oh,
so
yeah.
We have to stop that.
Okay, so then what are the improvements that you've noticed since the beginning of treatment?
Well, before I had headaches every day. My jaw would be sore from a tic, but when I put this in, my jaw tic settled down. It's pretty much gone now. I haven't had a headache yet. I've maybe had 1 or 2 within the month, but that could have been anything. But I feel better. I notice when I take it off, my tics do come back, but I see a major improvement every day. I used to not be able to talk to people without having a massive load of tics, but now I am. I'm able to go to shops, Walmart, anything, and just browse. I used to not be able to do that before, but now I am able to.
This is Zachary. Zachary's a 22-year-old boy who first experienced Tourette's at 7 years of age. He came to my office a day or 2 ago, and we took an MRI on him. We took x-rays on him today, and we've prepared a splint for him, and we're going to deliver it today. Tell the audience what you've been going through the past 8 years or so with your Tourette's. Tell them all the tics you have. You have head tics, face
Head
tics.
tics, facial, some verbal, like grunting, whole body jerks, shoulder. I mean, I probably tear a lot of muscles, pull muscles with my shoulder tics that I have. Always sore. I mean, I never complain about it, but I'm always sore 24/7. Hopefully they go away.
You sweat a lot.
Yeah, I mean, I drink maybe 3-4 gallons of water a day, and it comes right back out like it's nothing. So,
Okay, how do you do at school?
not very good.
Grade-wise?
B to D. I mean, college, it was a lot better. It was A to C, so I don't know.
How do you do with the girls?
All right. I mean, I got my girlfriend right over there.
But other than her, I mean, well, most girls get turned off by her.
Yeah, I'd say so.
Yeah, you got one that understands you. Huh?
Yeah.
Okay, well that's good. That's better than most guys have.
Yeah.
Okay, and your mother found out about us on the internet, huh?
Yep.
Okay, good. Okay, just stare into the camera a lot, and show the audience some of your tics. And this goes on all the waking hours, 24/7, right?
Even when I try to sleep, I mean, I was up till about 2 in the morning last night, and sweating really bad.
How long does it usually take you to get to sleep every day, every night?
I don't know. If I try going to bed early, I mean, I'll stay up late. I mean, my mom works third shift. I call her at 3-4 in the morning, and I gotta get up at 6:30 to go to work. So I mean, I might get 2.5 hours of sleep each night.
Oh.
And I mean, I can go a full 8-12 hour day at work without being tired. I mean, I'll get home, and then I'm just physically as sore as can be. I mean, I feel like as in a weightlifting competition or something, extremely sore. Can't stop sweating ever.
Most people take 15 minutes to get to sleep. You take much longer than that.
Yeah.
Because most of my Tourette's patients say they take 2 hours to fall asleep at least at night. That's a curse, in my opinion. You know, if you can't sleep soundly, that's one of the curses in life. Okay, let's see what we have here. Bite. Chop, chop. Tap down. Does one side feel higher than the other when you tap down?
Mm-hmm.
Open. Which side feels higher?
Right.
Right side?
Yeah.
Okay. May feel that's that way, but see, it looks like you're hitting even heavier on the left side. You see how the marks are darker?
Yeah.
Right. That slows him right down, doesn't it?
It sure did. It's amazing.
Okay.
How's it feeling today?
Alright.
Does it hurt you in any way, shape, or form?
No. It's just a little uncomfortable. I'll get used to it.
Yeah, you have to get used to it, like with contact lenses. That's the best thing I can relate it to. For about
Okay.
24 hours, 36 hours maybe, and then you won't even notice it in your mouth.
Alright.
And if he grinds his teeth a lot at night, you know, he may wear it down and the symptoms may come back, and then you come here and I'll rebuild it back up again, and then symptoms may creep back and I'll rebuild it, and so on and so forth. That's how it works, but I won't have to do that as frequently, you know. That'll lengthen and lengthen and lengthen like that.
Okay.
I can talk better than I thought I would be able to with it in, but
Yeah, it's not going to be like the tongue blades you
Yeah.
had. Yeah. See?
and I won't drool all over myself either.
Right, and no one's going to see it. See, there's a
Yeah.
lot of advantages to this.
Yeah.
Yeah, you think this isn't going to slow down your kissing of this young lovely here with like the
Oh, it won't.
tongue blades?
It won't.
Yeah, okay. You want to try kissing them now? Just kidding. Okay.
That's all right.
Not while the camera's going, anyway. Okay. Each time you come, we're going to want to record you and just notice the improvement.
Okay.
Zach has seen a psychiatrist, a neurologist, 2 psychiatrists actually, and the one he at one point was taking 6 different medications. He weighs about 215 pounds now. At one point he weighed 320, and it was from the medications.
Wow.
And really it was no improvement. They just kept adding medications, hoping that it would help, but it never did. They tried Ritalin, all kinds of medications. All the antipsychotics that were real hard on him. He had some of the tardive dyskinesias even from the medications, where he'd have to take him into emergency room and have the reversal drugs given to him, and it's been a long 13 years. So this is amazing that it can be drug free.
This patient returns after 4 weeks of receiving his appliance. He reports 2 very, very good weeks, 1 so-so week, and then the 4th week, which was very bad. His tics had returned because he had worn down his appliance due to constant grinding on his on the appliance. And open. Perhaps you can see and hear the indentations where it's all worn down. And what we're going to do is refresh this today and build it back up and reinsert it in his mouth and send him back on his way. And the rebuilding of the appliance is going to eliminate these tics and these uncontrollable movements. Okay. About 8 minutes have gone by since we took this out of the patient's mouth bite. We're putting it in, and I'm going to adjust it. Is one side higher than the other?
Yeah.
Okay, which side?
Left.
Left. Chop, chop. Okay. You notice how the patient's symptoms have almost decreased completely, not quite, once we put the appliance back in. I'm just going to adjust it, fine tune it, open. You can see how he's hitting much harder on the left side than the right side, so I'm going to lower this left side here. Just tap up and down. Good. Right. That should feel pretty darn even. Right. Tap about 5 times. And that'll reset your nervous system. That's the entire adjustment, believe it or not. That's all that's needed. That feel better?
Yeah.
Calms you right down?
Yeah.
You owe me $100,000. Okay. That's a total of about 11 minutes for this appointment. It doesn't get any better than this. That's all that needs to be done on these patients. Now, if he doesn't wear it down, he'll be symptom-free for a longer period of time. If he wears it down, we just rebuild it, and his symptom-free intervals will get longer and longer and longer and longer and longer as time passes. Okay?
Yep.
This young man presented with head jerks, twisting of the neck to the left and the right, bilateral wrist tremors, bilateral arm jerks, bilateral leg jerks, vocal tics, constantly saying, "No, no, no." This boy's TMJ symptoms were bilateral frontal, temporal, and occipital headaches 2 to 3 times per week for the past 5 years. Bilateral mastoid pain for 5 years. Photophobia, bilateral retroorbital pain, vertigo and lightheadedness, loss of equilibrium, bilateral tinnitus, bilateral TMJ clicking upon opening of the mouth, bilateral TMJ clicking upon protrusion of the mandible, bilateral TMJ crepitus, bilateral suboccipital pain, bilateral neck pain, stiff necks in the morning, cervical crepitus, bilateral shoulder pain. This is this young man's panoramic x-ray. Notice the impaction of his wisdom teeth. It is always best to get these teeth taken out prior to the institution of treatment so that the discs are not dislocated after you started treatment or the case is made more difficult by this surgery. Get all surgery done prior to delivering the appliance. If the patient needs other types of surgery like gallbladder surgery, colon surgery, female type surgery, get all of that done prior to instituting the treatment and reevaluate the patient after they've had their general anesthetic for these surgeries, because frequently the intubation process will adversely affect the temporomandibular joint. This is this young man's cephalometric x-ray. Notice the good drape of his soft tissues of his profile. The lower lip is not horizontal, it is vertical. The upper lip drops vertically too. He also has an excellent airway going for himself, which is good. Many of these patients will have a very narrow airway. This is another view of this patient's airway. Look how excellent and wide this is. Also note he's got compression of his suboccipital tissues. You're supposed to have a 14 millimeter space between the base of the skull and the top of C1. And C1 is supposed to be at a 45-degree angle like this. And as you can see, it is horizontal. This is a young 23-year-old male with all kinds of facial and neck tics. He's in a very unusual case. Instead of these tics beginning at the age of 6.5 or 7 like most of them do, these began just recently at the age of 22. So he's had them for the past year. He's got 4 different types of diagnoses. Tell them what you have.
They have diagnosed me with 4 different types of dystonia. Cervical dystonia, myoclonus dystonia, generalized dystonia, and dystonic tremors, rapid onset.
Okay. They started with his left leg a year ago. We gave him a bunch of tongue blades to play with last night, and he returns and says that he was able to go to sleep after about an hour instead of the usual 3 or 4 hours it takes him to get to sleep last night, with 8 tongue blades in his mouth. And he likes a vertical dimension of between 8 and 11 tongue blades. And so we're having the appliance made at a laboratory today and overnight, and we'll deliver it tomorrow morning and show you. It will be at least 8 tongue blades high and as high up as 11. And that will be our starting point. This young man returns the next day and told me that approximately 9 tongue blades diminished his head shaking somewhat and allowed him to fall asleep in 1 hour instead of the usual 3 or 4 hours it took him to go to sleep every night. And this translates into about an opening of 16 millimeters interincisally. And so what we did today was make him his lower appliance, add the acrylic onto it, and have him close down. And you can see how this is approximately slightly less than that. I'll tell you what, take that out. I'm going to make it taller.
Last night, whenever I laid down, I fell asleep within probably 5 minutes of laying down, whereas before it would take 3 to 4, maybe even 5 hours to go to sleep. I would stay up till 4 or 5 o'clock in the morning before I was able to fall asleep. But with this new mouthpiece, I was able to fall asleep within probably 5 minutes with no sleep aids, as the doctors were trying to prescribe me before I came to see Dr. Stack. And now I have no problem going to sleep, and I don't have to take the sleep meds that they were trying to get me to take before.
This young man returns in less than 24 hours wearing the appliance. I want to show you how thick we've made it. He is occluding on the appliance now. It is 15 millimeters tall. Don't be afraid to go into an open bite situation by making a tall appliance like this. Now, this young man is going to tell you what he's experienced over the past 24 hours or less.
I got my mouthpiece from Dr. Stack yesterday afternoon. Before seeing Dr. Stack, I was not able to walk up a flight of stairs without having to either take a break or climb on my hands and knees the rest of the way up. And yesterday I was able to get out of the car, and I probably walked about 3 miles seeing all of the national sites in Washington, D.C. And I even walked up the Lincoln Memorial with hardly any problem. I had to just stop one time to get a break, and before I would have only made it maybe 3 or 4 steps, and that would have been it. It feels almost like my life's been given back to me. I can't thank Dr. Stack enough already for the changes that I felt, and I know it's just going to get better as time goes on.
Okay, you can become a rich man and remember me in your will.
Yes, sir.
Just teasing. Okay. We're going to let this young boy go. He's 23 years old. He's married. Do you have any kids?
No kids.
No kids. Okay, he's going to go back to his young wife now. And we're going to see him in 6 weeks or so for the first checkup. This patient returned 6 weeks later for his first checkup. He told me he had 5 very, very good weeks in which he was approximately 90% better. And then his tics started to return in the last week. I rebuilt his appliance up, the 1.5 or 2 millimeters it was worn down, and sent him back home. He told me for the first time that he was taking 23 medications per day, and that over the 6 weeks he had reduced it down to 6, only taking 6 pills per day now, and he considers that a massive improvement. I'll consider it a great improvement when he's taking no pills per day. This is a 27 or 28-year-old young man who presents with 20 tics: eye blinking, eye rolling, head jerks, shoulder shrugs, facial grimaces, mouth opening, throat clearing, grunting, yelling, and screaming, barking, coughing, squeaking, pitch or volume changes in his voice, echo phenomena, which means he repeats what other people say, arm extending, touching objects, finger smelling, jumping or skipping, thrusting of groin or torso. The clinical information we received on him was that he was diagnosed with Tourette's syndrome at 9 years of age. He was put on multiple medications. He has blurred vision. He states, "I feel like I am going to pass out." This is a feeling which is with him constantly. He has subjective hearing loss, bilateral finger numbness, and his TMJ MRI was negative. TMJ information is that he had bilateral clicking upon protrusion of the jaw. He had no clicking upon opening the jaw. He had right frontal, temporal, and occipital headaches, increasing in severity. He has left retroorbital pain, right ear pain or right otalgia, bilateral tinnitus, bilateral face pain, bilateral preauricular pain, and bilateral lower jaw pain. He has difficulty chewing food, a constant sore throat, feeling of a foreign object in his throat, bilateral suboccipital pain, bilateral neck pain, bilateral stiff necks, cervical crepitus upon movement of the head, and right shoulder pain. This is this patient's cephalometric x-ray, and it is an example of a patient who does not have a very good airway. Look how narrow this is. Look how overgrown or enlarged is his soft palate that blocks this airway almost completely. This is this patient's frontal head x-ray. Even though C1 and C2 seem to be centered and aligned in the midline of the patient's head, notice that C1, which is this whole bone here, is rotated because this is the spinous process of C1, this pointed structure, and is supposed to be aligned with the odontoid process of C2. The midline of the teeth, the odontoid process, and the spinous process should all be in the same line in the midline of the patient's head. This is a young 28-year-old man that presents with Tourette's syndrome. We have given him the tongue blades to find out at what height, what vertical dimension his symptoms decrease. And in the last 2 days or so, he has determined that 8 tongue blades are what stops everything. So put those in. Here he is with 8 tongue blades in, and this is what gives him total relief. In measuring, come in on this, 8 tongue blades equals 15 millimeters, inner incisal opening. Okay, this will be our starting point. Okay. We have just increased the height of his appliance about 1 millimeter, 1.5 millimeters on both the left and the right sides. And he states that his urges have decreased from 50% to 70 to 80% less than they usually are. We'll dismiss him for the night with this degree of treatment and reevaluate him tomorrow morning in about 17 or 18 hours before he leaves home for Kentucky. What's it done for your urges?
Well, the urge is still there, but it's, not like it was.
How much less? Like 50%, 80%?
Oh, probably 50%.
Okay.
I didn't know if it was not yet high enough or what.
Well, usually I make it higher tomorrow, but I might do it right now, in fact. Okay, spread your teeth here. Okay, zoom in on that. Okay, I'll get a ruler and okay, you can see this appliance results in a 8 to 9 millimeter inner incisal opening, which he says his urges to tic are about 50% gone. So we're going to increase it a little bit more today, see if we can get a better decrease in his urges to tickle.
It's made a big difference, and appreciate Dr. Stack and what he's done. It's a change in a life.
Yeah. This gentleman returns after 17 or 18 hours of wearing his appliance. It was delivered yesterday afternoon. He says his tics and his urges are down approximately 75%, and that wasn't good enough for us, so we increased the vertical of it approximately 1.5 millimeters on each side, and we have rebalanced it, and you can see the difference it's made. Now, say something to the viewing audience.
It's like I said, I had it in, and the tics have went from 75% probably to 90% now, and no urge so far to do anything. It's a lot more comfortable than I thought it would be. It's not very invasive, but takes some getting used to. But it's definitely an improvement.
Okay. That's a 90% reduction in his Tourette's tics in 17 hours. No one else is capable of doing that. How many years have you been trying to get treated?
Since I was about 8 years old. I'm 28 now, so 20 years.
20 years of treatment. This gentleman has had his lower appliance exactly 1 month. Tell him what you've been experiencing in the 1 month you've been wearing it.
Just getting used to it. Wore it down pretty good, but even at its worst, the tics have been 50% better, 60% better than what they were before I ever had it done. But it's not a problem to eat with it anymore, not a problem to talk with it. It's, like I say, at its worst, still an improvement, 60% improvement.
Your family members and friends and acquaintances, what's their impression been?
They're just speechless. They can't believe it. It's just anybody that knows me knows that it's changed completely. Like I say, when I got back and it was built up right, nobody could just hardly believe it because it all just disappeared.
Okay. Today we have resurfaced his appliance and built it back up. The amount that he ground it down plus a little more. And we're going to fit it to him right now. I tightened it up for you too, huh? Bite. Okay. Chop chop. Okay. Does one side feel higher than the other?
Yeah.
Which one?
Side,
okay.
right here.
Okay, take it out.
I can feel it more on my front teeth there than.
Gotcha. Okay. How's that feel now?
That's better.
Better, okay. Does it decrease your urges?
Yes.
Yeah, okay. Okay, I'm going to give you a little more room for your tongue here. And then This is a Tourette's patient with 41 different tics. He has eye squinting, head jerks, tossing of hair off of his face, facial grimaces, mouth opening, nose twitching, shoulder shrugs, arm extending, eye rolling, bilateral blinking, sniffing, grunting, yelling, screaming, throat clearing, coughing, and squeaking. He touches objects, touches people, smells his fingers, smells objects. He has jumping, skipping, and hopping tics, poking or jabbing, punching, kicking, flapping arms, twisting and twirling around. He tenses muscle groups uncontrollably, thrusting movements of the groin or torso, breathing tics, walking on toes, unusual changes in voice or pitch of voice. He makes animal-like sounds, stuttering, obscenities, socially taboo phrases. His MRI report stated that there was no TMJ displacement identified. There were no bone abnormalities. He had bilateral limitation in the TMJ range of motion. The clinical information that he provided was no previous orthodontic treatment, diagnosed with Tourette's at 5 years of age. I noticed his mandibular frenum, or center of his mandible, was 4 millimeters to the right of the maxillary frenum. Bilateral hearing loss. He had left retroorbital pain, vertigo and lightheadedness, loss of equilibrium, bilateral tinnitus, bilateral face pain, right TMJ clicking upon mouth opening, right TMJ clicking upon mandibular protrusion. which leads you to wonder why the MRI did not pick that up. He had left TMJ crepitus upon mouth opening and protrusion. He also had bilateral frontal and occipital headaches. Additional symptoms were that it was painful to chew food, difficulty swallowing, bilateral suboccipital pain, painful to turn his head either left or right, bilateral neck pain, stiff necks in the morning, cervical crepitus upon head movement, and bilateral shoulder pain. Okay. This is a 29-year-old patient that presents with 40 different tics. We are just starting him today. We have taken impressions for a mouthpiece, which we will deliver next week. We have just received his MRI report, which is totally negative for internal derangement. Okay, we're just going to let the camera run for a few minutes while we show some of these tics that this young man is suffering from. We've given him some tongue blades, and we're very hopeful because 3 to 4 tongue blades greatly diminishes his tics. And that will be the height at which we begin construction of his intraoral orthotic. We're going to have it made over the weekend. This is the last day of the week that we're going to work. We're going to have it made and presented to him next week. Okay, here we have loaded up the occlusal surface of the appliance with soft acrylic, and we are going to take the sticks out of his mouth open and replace it with a soft acrylic. And just close on down. See, touch lightly. Okay. Open. We are removing this from the mouth. This is what it looks like. Notice how motionless he is when his mouth is wide open. And we're going to flatten it down to where these 4 impressions or imprints are, where these 4 imprints are on each side. What we are going to do is level off the occlusal or biting surfaces on both the right and left sides of this appliance. And we do it by using this lathe with its 3-inch wheel. And we hold the appliance against the side of the wheel like this until the center row of depressions of the lingual cusps of the maxillary teeth are almost gone. So we keep putting it against the side of the wheel until they just about fade away. Then we narrow this occlusal surface, leaving about 3 millimeters of acrylic to the inside of that line, and about 3 millimeters of acrylic to the outside of that line. That is to the outside of that center line. Like so. And we get rid of any excess acrylic.
We bevel the back about 45 degrees, where the acrylic fits over the second molar. And we do the same on the opposite side. First we flatten the occlusal surface. So we just have this center line of representing the maxillary teeth. We will cut. We remove all the excess acrylic, except for about 3 millimeters of it. Then we go to the outside of the appliance. We level the back in the second molar area, 45 degrees. Okay, tell the viewing audience how you feel. You've had this in your mouth now 5 minutes by the clock.
Well, as I guess planned, the urges have dissipated. They're not as severe. Still getting an occasional urge to twitch, and those aren't even as prolonged as previous. So far, I definitely think it's working. As I said before, it's definitely doing what it's supposed to.
Put a number
the
on
urges. Yeah, like about 60% less urges, at least. I mean, for me, it's hardly noticeable anymore.
Okay, this is the end of the delivery appointment. After 5 minutes, his urges are down 60%, which is typical. That's what we've noticed in most of these young adult males. And once the urges go away, then the actual motor movements go away shortly thereafter. So we're highly encouraged. I want you to pay particular attention to how you sleep tonight and the next night. I got it open. You notice I got these ledges here for your tongue. You keep your tip of your tongue up here like that, and that'll make you sleep better at night because it'll open up your throat and you'll breathe better. You get more oxygen.
We delivered this gentleman's lower appliance 1 week ago, and he returned today to receive his upper appliance. We have put in his upper appliance a few minutes ago. We'll dismiss him now and see him in 3 weeks' time to see how he's coming along with both appliances in. We have adjusted the upper appliance that we delivered today to the lower appliance and rebalanced everything out.
This young man has now had his appliances for a total of 3 weeks, and you can see the difference.
Over the last 3 weeks, I've noticed a great deal of a benefit from these devices. At times, up to 80% difference in the reduction of the ticking from Tourette's. I mean, as you've probably seen in the last videos, you know, my head, my arms, legs are going crazy. At this point now, it's not the case. Occasionally I do have, you know, tics, outbursts, but they're mainly limited to my neck. My arms and legs really don't twitch at all anymore. So I'm very grateful for this treatment. It's definitely done a lot for me.
Is this young boy's mother who's going to tell you the improvement in the last 3 weeks?
We have been so pleased and so blessed that Brian is seeing this kind of improvement. He can sit through a meal, he can read some now. He does not suffer from the headaches and shoulder aches that he used to. He can drive. I don't worry so much about him driving anymore, that he's going to have outbursts and run off the side of the road or something like that. I'm just very, very grateful for everything that Dr. Stack has been able to do for Brian, and I'm happy for Brian that his life is, since he was 5 years old and now he's 27, that things are looking very, very positive for him.
This adult Tourette's patient reports that his tics began at 6 years of age and that he has obsessive compulsive disorder, vocal and physical tics. His MRI says the left anterior disc displacement with reduction. Left condyle has a round extension on the superior surface. This is usually a chondroma. 3 tongue blades in the mandible positioned edge to edge decreases urges by 30%. We know that if we make him an appliance, the height of which is 3 tongue blades, we have a good chance of success. When we made him an appliance, his tics were 80% eliminated within 24 hours. The TMJ symptoms he reported are typical TMJ symptoms we find in most of these patients with movement disorders: bilateral frontal, temporal, and parietal headaches, bilateral retroorbital pain, vertigo and lightheadedness, bilateral otalgia, bilateral tinnitus, left face pain, bilateral maxillary sinus pain, left TMJ crepitus, right TMJ popping on opening and protrusion, cervical spine crepitus and neck pain, bilateral shoulder pain. This is this patient's MRI in the closed mouth position on the right side. Notice the right condyle, how nice and round and smooth it is, and that the lamina dura goes all the way around it, and the disc is interposed between the condyle and the eminence. This is an additional view of the same right TM joint. When looking at these MRIs, it is always beneficial to compare one side with the other to get an overall impression of symmetry between the two condyles. This is the condyle of the left temporomandibular joint in centric occlusion. Notice this upward extension. This is going to affect the functioning of this joint. Notice that it is round and not pointed like previous ones that you have seen. The previous ones are made out of bone and are called osteophytes. When they are round like this, they are made out of cartilage and are called chondromas. This is another view of the left TM joint, chondroma, on the superior surface of the left condyle. In a more lateral slice through the temporomandibular joint, notice that the back of the condyle is flattened. You can tell that this image is more lateral than the previous ones because the muscle fibers are running vertically up and down. This is a temporalis muscle. In this condyle on the left side where the chondroma is, you can see this is a medial view because the fibers run horizontal. You can see by the horizontal orientation of the muscle fibers that this is the lateral pterygoid muscle. So it is a more medial view than the views with the muscle fibers running vertically. This is a view through the patient's left temporomandibular joint, and it appears that there is disc material located laterally to the condyle as well as medially to the condyle. You can surmise that this could only happen if there was a large perforation in the disc and the condyle was poking through the disc with the remnants of the condyle displaced to either side of the condyle. This is a wide open MRI image through the right temporomandibular joints, showing that the condyle travels past the eminence and is in place between the two bones. It looks like there may be the appearance of a little cratering of the eminence right here. This is a wide open view of the left temporomandibular joint, showing the condyle with its chondroma does travel past the eminence, and the disc is interposed in between the two bones. This is the young man that you saw yesterday. We've delivered his appliance about 5 minutes ago, and already he says his urges are about 40% less. We're going to see him again tomorrow. Is it in the morning? Tomorrow morning. And we'll check and rebalance the appliance and do any fine-tuning that's necessary after he's worn it for about 24 hours. This gentleman has now had his appliance a total of 24 hours. And you can see that his movements and his vocal tics are greatly decreased. In fact, his wife estimates they're approximately 80% decreased in the 24 hours that we've had the appliance in. And he will address the audience now and give you some more information. Okay. Just tell him how you feel.
My wife says like 80%, and to me like the biggest impression that I have is that I have a little more control over my urges. Like before, once the urges coming, I basically can't really control, so I just have to do it. So, but then now I have a little more control, and I believe that I've been having this Tourette syndrome like more than 20 years, so it's been quite some time. So I expect that as I get used to this appliance, I will be improving more about that. And my previous experience about how they approach to heal or to cure my Tourette syndrome was, I've done basically everything. If you name it, I've done everything: medication, behavioral therapy, and all kinds of tests. I've done everything. Like, and I was hospitalized in the mental hospital for 18 days and everything. But then those medications were like side effect of those psychotic medications were like killing me. I would rather have like that Tourette syndrome than like being not myself, but because of side effect of that they caused. So I was really impressed with this fairly quite safe treatment, and it is showing some improvement or some effect on me after 24 hours. So yeah, I was quite impressed with this, and I expect some more improvement continuously. And I thank Dr. Stack about it.
This is this gentleman's wife, and she wants to say something to the viewing audience.
Well, the first time he's had the appliance, I saw a great difference. It was the very first time we went out for shopping, and he didn't really have a lot of vocal tics, a lot of motor tics. He usually have like a lot of it, but yesterday it was like I would say like every half an hour he would have it, and it's a lot improvement. He would usually have it like in a minute. He would have his tics like 5 times in 1 minute, but yesterday it was just like every half an hour to every 45 minutes.
You were counting that.
I was. So I'm very hopeful for this appliance. Even when we're just together, it has shown a lot of difference, and I'm pretty sure it's making him more comfortable and less tired and stuff. And I'm very hopeful that this appliance would really work.
The last doctor we met, the neurologist, told me, you know what, this disease doesn't kill you. Why don't you adjust a little bit, learn how to live with it? And that was,
yeah.
No.
Well, he's insane. How was your last night's sleep? Did you sleep better or?
Yeah, I slept good. Honestly speaking, this is causing me so much discomfort right now. So my first thing that I need to do is that I need to get used to this. So I find it a little hard to eat and sleeping, stuff like that. But anyway, that's all minor thing. My priority is to get my body or Tourette syndrome improve, the symptoms improve. So I'm ready to get adjusted with this discomfort, and well, they said like it'll take a few days, so I don't think it's too bad. Yeah, I slept good.
This patient returns after 7 weeks of wearing his lower repositioning appliance. Zero in on his mouth.
Okay.
Okay, spread your cheeks. Let's see. This is the position in which we have it today. We have resurfaced it to make it a little bit taller, approximately 1 to 1.5 millimeters taller, to compensate for the wear that he has done in the past 7 weeks. You can see the difference in his symptomology between then and now. Okay, relax. You can relax. Put your lips together. This is a cervical dystonia patient. Dystonia is a neurological condition affecting the cerebellum, causing uncoordinated movements, imbalances, and other symptoms due to decreased dopamine in the brain. The clinical information we obtained on her was that she had 6 years of previous orthodontics as a child. 6 permanent teeth were extracted. She wore a cervical headgear for 4 years. Her jaw problems began 23 years ago. She was diagnosed with right lateral collis and anterocollis. She has bilateral frontal, parietal, and occipital headaches, which began 23 years ago. They are increasing in frequency and severity. She also describes migraine headaches and jaw pain increasing in severity. She has bilateral retroorbital pain, photophobia, which she has had for years and years, vertigo and loss of equilibrium, bilateral tinnitus, bilateral otalgia for the past 23 years, bilateral hearing loss, bilateral preauricular pain, bilateral maxillary sinus pain. She also has bilateral masseter pain, bilateral lower jaw pain, right facial numbness, which is of a pins and needles quality, inability to open the mouth. Her mouth locks shut. It's painful to chew food. She has dysphagia, or difficulty swallowing, for the last 20 plus years. She has a feeling of a foreign object in her throat. She has constant throat clearing, bilateral suboccipital pain, inability to turn her head to the right, cervical crepitus upon movement of the head, bilateral stiff necks in the morning, right neck pain, and bilateral shoulder pain. Her MRI report stated that the left TMJ disc was anteriorly displaced without reduction. There was no evidence of right TMJ disc displacement. However, there was flattening of the right mandibular condyle, bilateral limited range of motion in both condyles, and joint effusion in the superior compartment of the left TM joint. On the day of the splint insertion, I made her splint 11 millimeters thick. Her maximum interincisal opening was 17 millimeters unforced and 20 millimeters forced. One day after splint insertion, her opening was 33 and 35 millimeters. Patient stated that, quote, "I am very much better," and this was after just 1 day. 5 weeks later, upon a return visit, her maximum interincisal opening was 35 to 36 millimeters. The patient stated that her pain was 60 to 70% gone. "I am absolutely wonderful," she said. This is this patient's cephalometric x-ray. She has an airway of average width here. This is the type we usually see. Notice the elevation of C1 here and a total compression of the suboccipital tissues. There is no 14 millimeter opening between the undersurface of the occipital bone and the top surface of the first cervical vertebrae. Notice the non-parallelism of her mandibular borders, indicating a temporomandibular joint problem, usually on the side above the higher border. Notice this protrusion of her upper teeth, but this is really not a true protrusion because her upper lip drapes down and is not protruded forward with the teeth. What this really is a distal displacement of the mandible. The mandible is too far back posteriorly. This is this patient's MRI. This view shows the anteriorly displaced disc. This is on the left side. We can tell that this is the patient's left temporomandibular joint by looking at this icon that is put in the upper right-hand corner, which shows the slice that the MRI is taking of this patient's joint. This is the image through there. It shows the anteriorly displaced disc in black with a white area of inflammatory fluid in the superior compartment overlying the disc. This is an MRI of the patient's right temporomandibular joint. We look up here and confirm that it is on the right. This is the condyle, and you can see that the disc is in place on top of the condyle, but you can see that the superior surface of the condyle is being eroded and some cratering is forming. This is on the lateral pole. You can tell it's the lateral pole because of the vertical fibers of the temporalis muscle. This is another view through the left temporomandibular joint, showing the anteriorly displaced disc with the inflammatory fluid in the superior compartment. This is another image through the lateral pole of the right temporomandibular joint. We look at our icon to confirm it's on the right side. You can see this black area on the top of the condyle, which is a little area of osteonecrosis, which means this area is getting no blood supply and this bone is breaking down. This is one of the initial steps you'll see in the cratering process. This is another MRI image through the right temporomandibular joint. You can see the cratering process right here at the end of my pointer. You can see the anteriorly displaced TMJ disc is this dark black bundled up tissue. This is a young lady who presents today with cervical torticollis to the right side. We examine her and she has a closed lock TMJ problem. Open her. This is her maximum interincisal opening. It measures at 17 millimeters. She has been to numerous healthcare providers, dozens of them, and none of them spotted this problem. When we give her some tongue blades, 5 of them on the right side, her head straightens up. Okay, now when we take these out, try turning to the left. She has increasing difficulty turning to the left, turn to the right. Okay. Turn to the left again. Okay. Now we'll put these in again. It's much easier and she can turn further. So we know that with these 5 tongue blades, if we make her an intraoral appliance starting at this height, we have an excellent chance of success. When we examined this patient, she gave us a history of having been to multiple healthcare providers, including 4 neurologists, a structural integrationist, an upper cervical spine chiropractor, 4 additional chiropractors, a reflexologist, 3 physical therapists, 2 dentists, and 1 hematologist. When we examined her from a TMJ perspective, we noticed her maximum interincisal opening was 17 millimeters. Show them how much you can open your mouth, just the maximum opening. Okay, 17 millimeters. Why none of these other healthcare providers noticed that she had a dislocated jaw boggles the mind, because that is why she can't open. She's now going to go, while the appliance is being fabricated by the laboratory, we are going to send her out for an MRI to document the disc displacement that is causing the limited opening, which is the underlying cause for all of these problems. Okay, with these 5 sticks on the right side, which are always placed to the right, to the side towards which she turns, Her head straightens up, her head tremors instantly stop for the most part, and she no longer has to support her head with her left hand. Okay, this patient returns after 24 hours of wearing her appliance, and all we did was rebalance and polish it today for about 3 or 4 minutes. She's going to tell you now what she feels from wearing it for the past 24 hours.
I can swallow food very well for the first time in about 20 years, and I was always told that that was from an esophageal problem by gastroenterologists. Overall, I feel much less tightness. I'm able to eat and drive, and there's still some tightness, but I'm confident that that's going away. My neck is already so much looser. I couldn't have done this before.
This lady had an MRI report which stated that her right TMJ disc was anteriorly displaced. She had an osseous defect in the right mandibular condyle due to arthrosis, severe limitation of range of motion of the left condyle. Her clinical information was right torticollis and cervical dystonia. She suffered from sleep apnea and has been using a CPAP for the last 10 to 12 years. She has difficulty swallowing, bilateral face pain, right jaw pain, bilateral suboccipital pain, bilateral neck pain, and bilateral shoulder pain. She had bilateral TMJ popping and clicking. Her maximum interincisal opening was only 43 millimeters. She suffered from photophobia and loss of equilibrium. She had right tinnitus. After she was in treatment for a short time, she revealed to me that she used to be an invalid in bed all the time. Now she has lots more energy, she sleeps better, no more headaches, no more right jaw pain. I'm much more active. I'm taking water aerobics. This is this patient's cephalometric x-ray. She has an airway of average width here. This is the type we usually see. Notice the elevation of C1 here and a total compression of the suboccipital tissues. There is no 14 millimeter opening between the undersurface of the occipital bone and the top surface of the first cervical vertebrae. Notice the non-parallelism of her mandibular borders, indicating a temporomandibular joint problem, usually on the side above the higher border. Notice this protrusion of her upper teeth, but this is really not a true protrusion because her upper lip drapes down and is not protruded forward with the teeth. What this really is a distal displacement of the mandible. The mandible is too far back posteriorly. This is this patient's MRI. This view shows the anteriorly displaced disc. This is on the left side. We can tell that this is the patient's left temporomandibular joint by looking at this icon that is put in the upper right-hand corner, which shows the slice that the MRI is taking of this patient's joint. This is the image through there. It shows the anteriorly displaced disc in black with a white area of inflammatory fluid in the superior compartment overlying the disc. This is an MRI of the patient's right temporomandibular joint. We look up here and confirm that it is on the right. This is the condyle, and you can see that the disc is in place on top of the condyle, but you can see that the superior surface of the condyle is being eroded and some cratering is forming. This is on the lateral pole. You can tell it's the lateral pole because of the vertical fibers of the temporalis muscle. This is another view through the left temporomandibular joint, showing the anteriorly displaced disc with the inflammatory fluid in the superior compartment. This is another image through the lateral pole of the right temporomandibular joint. We look at our icon to confirm it's on the right side. You can see this black area on the top of the condyle, which is a little area of osteonecrosis, which means this area is getting no blood supply and this bone is breaking down. This is one of the initial steps you'll see in the cratering process. This is another MRI image through the right temporomandibular joint. You can see the cratering process right here at the end of my pointer. You can see the anteriorly displaced TMJ disc is this dark black bundled up tissue. This is a lateral head x-ray of this patient showing the missing posterior teeth on her right side. Notice the very, very great discrepancy between the inferior border of the mandible on the right side and the inferior border of the mandible on the left side. This is a very great discrepancy between the two sides of the mandible. Again, she has suboccipital tissue compression. The black column represents a very impaired airway. Compare it to some of the ones you have previously seen. This is a lateral skull x-ray showing the patient's neck. Again, notice the airway, the inferior border of the mandible discrepancy, the suboccipital compressed tissues, but notice the lack of intervertebral joint space. There's supposed to be a 3 to 4 or more gap between each vertebrae. These are completely eliminated on this patient, which is a sign of severe osteoarthritis of the cervical spine. These black areas are intervertebral foramen that are not supposed to show up on a lateral skull x-ray. They show up only on an oblique x-ray where the head is deliberately turned 45 degrees to pick up these intervertebral foramina. You can see that some are quite small. This is compression of the intervertebral foramina, which encroaches upon the nerves that exit out of these foramina into the neck and down the arms. This is a torticollis patient that presents today for treatment. You can see how she has a left head tilt and the face is twisted to the opposite side. I have come to the conclusion that these patients all have an internal derangement, and we have had this patient get an MRI which has documented this. She also has severe condylar osteoarthritic degeneration of the right TMJ condyle, as documented by this MRI. This, of course, results in the mandible being malaligned to the cranial base, causing a decreased vertical dimension. You can see that she has at least a 50 or 60% overbite here, so she has a decreased vertical dimension. The majority of these patients will have a decreased vertical dimension, which results in compression of the temporomandibular joints and their contents, particularly the fibers of the auriculotemporal nerve, which feed into the trigeminal nerve. Consequently, we wish to decompress the contents of the temporomandibular nerve, and we do this by trial and error with these various tongue blades. Now we're going to have this patient close her eyes, and we are going to insert these tongue blades in her mouth, and we're just going to start with 5 tongue blades. Okay, just close your eyes and open your mouth and put these in, and we're going to have her sit here for a while and just watch what response we receive. You can see from this test that the cervical muscles start to release and the patient's head starts to turn slowly but perceptibly to her left. The longer we let her sit here like this, the more it will turn to the left. This indicates to me that this patient needs more support on the right side of her mouth. She is also missing teeth, molar teeth, on the right side of her mouth. So we are going to build her a mouthpiece that will replace these missing teeth, plus give her additional support to suspend her mandible away from her cranial base and essentially replicate the function that these tongue blades are providing temporarily. I'm just going to increase this open and close. Although it may seem longer, the patient has had the tongue blades in her mouth approximately 3 minutes. And you can see that at this point in time, her head is almost erect and her shoulders are just about level. To me, this is a good sign and indicates a good starting point for her mouthpiece. Now, open. What I'm going to do is just put these on one side. Bite. Okay. Now, just close your eyes and just sit here for a while with that. Let's see what that does for you on that side. Another clinical test I frequently use is to put the tongue blades in on one side only. This is usually the side to which the head is turned. That is the side I think needs the most support. As you can see, I put it in on this patient's right side. It's important to have the patient close her eyes and just sit as quietly and peacefully as possible and let nature take its course. This is what we're doing on the next day. Notice how erect the head is and how level the shoulders are. Okay, how'd that feel?
Relaxed.
Yes. Is that probably the most relaxed you've been in a while?
Ages.
In ages, huh?
20-some years.
20-some years. Huh? That's pretty good. Well, that gives us an indication of where we need to start, the height we need to make the appliance. Okay, bite. Bite. Here I am fitting the appliance to the patient's mouth. Okay. Okay. Now, let me take this out a minute. Let me put these back in this time. Okay, bite. Okay. Okay. This is the final product at the end of the first day appointment. We made this 8 tongue blades high on either side, and it improved the patient very much so, in our opinion. But we thought we could improve it even further, so we added the 2 more tongue blades in height to the right side and put it in the patient's mouth, which we're going to do now, and then dismiss her and see her 2 days from now. And you can see the effect when we put it in, fitting over her lower partial denture. Bite. And this is how much it opens the patient up. Don't let this increase in vertical dimension shock you. This is what it takes initially. Doesn't mean we're going to keep the patient at this height throughout the course of treatment. We're going to attempt to lower this as her symptoms subside. But you can see it causes the patient's muscles to relax and go out of spasm. And she'll describe to the audience what she is experiencing as this sits in her mouth the first few moments.
Experience a release of the tight muscles that I've had for so long, and a relaxation that I have not had for a long time, and above all, I guess I'm able to keep my head straight As before, it always wanted to rest on my right shoulder.
Tell them in years how long it's been.
It's been probably 22 years that I've had this condition, and my head has tried to always pulling to the right. It's a constant battle trying to look straight ahead, and the muscles have been extremely tight and very painful also. Sometimes it's extremely difficult to get to sleep. I've been limited in all activities, and this is totally different, being able to look straight ahead and to keep my head straight. Muscle relaxation is really amazing and relaxing. I can feel the difference. And it's gradually increasing the relaxation the longer I have the appliance in my mouth. I can feel the difference.
You want to stand up and see if there's a difference in standing?
I feel like I'm a little taller, but it's great to be able to look straight ahead. And I know there'll be a big difference in driving rather than having to fight to keep my head to the front all the time. So it's just totally different.
Your shoulders feel more level, straighter?
Much more level. I feel I'm getting more space in the diaphragm area, and that my head is coming more into the correct position that it should be. I can't really tell completely since I can't see myself, but it feels much more comfortable and at ease. My shoulder, my right shoulder is relaxed so that it's not pulling. Normally it would pull so that it almost touches my right ear, and my neck would go down so that the right ear and the right shoulder would almost touch. So I feel it's a vast difference. The longer I have this in my mouth, the more changes, subtle changes, I can feel.
Okay, that's the first 5 minutes of treatment. We will take some more footage 2 days from now and show you that. And this is how we treat these torticollis patients. Okay, go walk up to me. Okay, this is the patient walking. Okay. Now, is that an improvement in your walking?
Yes.
Okay.
I have much better balance. I can walk a much straighter line, and my feet don't flare out.
Does it feel more secure when your feet hit the ground?
Oh, much more secure.
Because that's a problem as you get older, feeling unstable and falling.
I didn't really have that feeling. I felt very secure. And
have you had that
easy
feeling
walking.
in the past? Have you had that feeling falling?
Oh yes. I've not been able to walk in a straight line. If I go outside, I wander all over the sidewalk, and also I've had to put my hands like this to keep my head forward so that I could see without sunlight.
This is our patient who returns 14 days after we last saw her, a total of 20 days since she received her appliance for torticollis. Tell the audience what's been happening in the last 20 days since you received your appliance, what difference it's made, what other people have said, etc.
Well, I've had a lot more energy. I've been able to go like all day long, and matter of fact, I just returned from a cruise, and I was able to go and to go on the sightseeing trips and to go all day long, whereas before in the afternoons I would begin hurting so much I'd have to stop and take a rest for 20-30 minutes, but I continued, on the cruise and all. I was able to go. Yesterday we drove for 10 hours. I feel fine today. I don't have any hangover from it and such, so I have lots more energy and generally feel much more upbeat, relaxed. I used to find myself leaning forward at times, and now I find I stand up straighter much more often, and even feel like pulling in my stomach and just having a more aware of my posture, whereas before it was just simply trying to get by, trying to get through the day. So and the tension, and I don't have any tension in my shoulders or my neck that I used to have. So all that has increased, gotten much better.
The inclination of your head and neck is much better, and you certainly are talking a lot more clearly. You're not having any trouble with the appliance, are you?
I have a little trouble eating some, but I'm learning to adjust to that. And I think once in a while I get a headache. I don't know if it's from the appliance or it's, adjusting, or it's otherwise.
Okay.
But that's about the only question I would have, is really about the occasional headache. Though I've had headaches before, I can't really say it's due to the appliance.
Okay. Excellent. Okay, this patient returns after wearing the appliance for 7.5 weeks. She reports that she has had a lot more energy and she is sleeping better. She has no headaches, which she had for once a week for the previous two plus years prior to coming to see me. Things are progressing right on schedule as far as I'm concerned, and the patient's doing very well. Would you care to say something to the audience?
The biggest change I have noticed is the tremendous amount of energy that I've had. Yes, that's not really a tremendous amount, it's that I lacked an energy before. If I would do housework after an hour, hour and a half, I had to take a rest. Now I keep going.
So are you feeling any better the last day or two?
Yes, I feel less tension in my neck and shoulders. Actually, they feel relaxed, normal, and it's really a great relief. And I felt some movement in through here, and just generally I felt much better.
Your head doesn't want to turn as much as it was?
Oh, my head doesn't turn nearly as much as it does. It used to be a constant struggle, just a constant battle, but now it stays mainly straight. Even the shoulder, which had built up a very hard area, is not as hard now. It's softened because of the turning has lessened. So it's much, much better. But to be free of all this tension and tightness to my neck and all across my shoulders, it's really been a tremendous help. And that happened very quickly with having the appliance.